AI in healthcare is a really broad topic. We have hundreds of great examples on how we can put it to use and create applications that help with CT scan analysis, make robots that assist with surgery, or accelerate MRI imaging. Can AI replace a professional doctor? No. And we've already discussed that a couple of weeks ago. You can click on the link down below to see what was it all about. But it can definitely be your best friend in this unequal fight between life and death, especially in the face of the latest threat known to humanity as COVID-19. Or can it? Good morning. When COVID-19 struck Europe in March 2020, the medical sector plunged into a health crisis that was still quite badly understood. The AI community, in particular, rushed immediately to develop software that many believed would allow hospitals to diagnose patients faster and bring much-needed support to the front lines. In theory. According to the latest article published by MIT Technology Review, hundreds of AI tools have been built to catch COVID. None of them made a real difference, and some were even potentially harmful. That conclusion is not anyone's subjective opinion, but the result of multiple studies published over the last few months. In June, Turing Institute, the UK's National Centre for Data Science and AI, put a report summing up discussions at a series of workshops it held in late 2020. The clear outcome was that AI tools had made very little, if any, impact in the fight against COVID. The report says clearly that AI technology will never be able to handle diagnostic tasks anymore, and humanity should stop developing those algorithms. No, it doesn't, but many people would probably think that way, since we finally had a great occasion to test out AI's capabilities on a real battlefield, and it failed. But the problems appeared to be more human-related, mostly linked to the poor quality of data that researchers used to develop their tools. Information about COVID patients, including medical scans, was collected and shared in the middle of global pandemic, often by the doctors struggling to treat those patients. Researchers wanted to help quickly, and these were the only public data sets available, but that meant that many tools were built using mislabeled data or data from unknown resources, and that means you should always make sure of your dataset quality and label your data properly. For example, using Snorkel AI platform, which has announced on August 9th that it has raised 85 million in a Series C round, giving them the total score of 135 million raised and the value of $1 billion. Founded in 2019 by a team spun out of the Stanford AI Lab and engineers hailing from Apple, Facebook, Google, Microsoft, and Nvidia, Snorkel enables companies to build AI-powered apps with so-called programmatic data labeling, with the goal of minimizing the need to hand-label model training data. Everyone knows that the proper data labeling is one of the biggest struggles for AI development, and the more we invest into it, the better for everyone. AI code creation subject has also been struggling with intellectual property matters. Examples like GPT-3 creations or OpenAI codecs used by GitHub's Copilot are being constantly questioned whether they should be considered under IP laws or, any kind of laws. A German researcher and a former MEP Julia Reda points out that copyright laws has only ever applied to intellectual creations, which means that if there is no creator, there is no work. Usually that means that machine-generated code like that of GitHub Copilot is not a work under a copyright law, since it cannot be considered as a creator. But that's Europe. And Australia decided to think differently. A federal court in Australia has ruled that AI systems can be credited as inventors under patent laws. In a case that could set a global precedent, Ryan Abbott, a professor at University of Surrey, has launched over a dozen patent applications around the world, including in the UK, US and New Zealand and Australia, on behalf of US-based Dr. Stephen Thaler. And here comes the plot twist. It's not Thaler, which Abbott is attempting to credit as an inventor, but his AI device known as Davis, that consists of neural networks and which was used to invent in an emergency warning light a food container that improves grip and heat transfer. Davis was awarded its first patent for a food container based on fractal geometry by South Africa's companies an Intellectual Property Commission on June 24th. Whether AIs should be granted certain rights similar to humans is a key debate, and one that is increasingly in need for answers. This patent case could be the first step towards establishing whether machines with increasing forms of sentience should be treated like humans. And whether they will or not depends on us, their creators. And it would be better if treated like humans could mean treated with dignity, compassion, and respect. After all, AIs should also create things to keep changing the world for better.